Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
In last lecture, we have completed half of the dental amalgam chapter, wherein we have seen the definition for dental amalgam. We have seen different types of classification for dental amalgam. Then we completed amalgamation, that is setting reaction for dental amalgam. Then we studied in detail about low copper alloys, high copper alloys, and we saw different setting reactions or amalgam reactions for all these types of dental amalgam. We have seen clinical manipulation of dental amalgam, how it is mixed, the way it is placed into the prepared cavity, and then it is condensed and carved. We have seen till here. Let's continue the topic further. So today, let's study properties of dental amalgam. So for dental amalgam, ADS specification number is 1. According to that, there are some important properties of amalgam which are considered before you use it as a direct restorative material. The first one is dimensional change, second is compressive strength, and third is creep. These are the measures of amalgam quality. So this will decide the longevity of the dental amalgam restoration. Let's see dimensional stability first. So amalgam can expand or contract depending on its manipulation. Severe contraction can lead to microleakage, plaque accumulation, and secondary caries. When we are not using sufficient mercury so that all the particles of gamma phase are not coated with with mercury, there won't be any formation of gamma 1 phase. The matrix will be less, very less. The granular mix that we have seen last time in the diagram. So that will basically contract from the cavity walls. It will lead to formation of some gaps between the cavity walls and the dental amalgam restoration, which will lead to microleakage through which there will be seepage of the oral fluids. Plaque accumulation will occur in that area, and these both seepage of oral fluids and formation of plaque will ultimately lead to secondary caries under the restoration. The caries which are formed into the tooth are called as primary caries. When the caries form under any restoration, those will be called as secondary caries. So when caries occur below this dental amalgam restoration, these will be called as secondary caries, and this is because there was contraction that occurred and microleakage happened. So that's why dimensional stability is very important for any direct restorative material. Not only contraction, at times there will be excessive expansion seen in the dental amalgam. If such kind of excessive expansion happens, it will produce pressure on the pulp and post-operative sensitivity will be felt by the patient. So there are certain limits where some amount of dimensional changes are accepted. It is in the range of 15 to 20 microns per centimeter, measured at 30 degrees Celsius between 5 minutes and 24 hours post-restoration. So once the amalgam is triturated, from that moment till 24 hours, only 15 to 20 microns per centimeter of any dimensional change, either increase or decrease, is acceptable. But beyond that, will either lead to severe contraction, forming dental caries, secondary caries, microleakage, and beyond this much of dimensional change, there will be excessive expansion and lead to post-operative sensitivity. Let's see how this dimensional change occurs. Let's study mechanism of dimensional change. What happens when mercury reacts with the dental alloy? There is basically formation of gamma 1 phase, right? So this final volume of gamma 1 phase is less than the sum of silver and liquid mercury volume needed to produce gamma 1 phase. So this will lead to contraction, and it will continue as long as the gamma 1 phase keeps on growing. As we know, it is 1:1. Most of the times it is the proportion is 1:1. So the final volume of gamma 1 phase is less than the sum of liquid and mercury volume. As the gamma 1 crystals grow, they will impinge against each other. So again, there will be contraction. When there is sufficient mercury present to provide a plastic matrix, then in that case, expansion will occur where more mercury is used. So in that case, expansion will occur and gamma 1 crystals will still impinge on each other. There will be outward thrust of these gamma 1 crystals and expansion can be seen. So basically it is gamma 1 phase in which all the changes are occurring, either contraction or expansion. Because gamma 1 phase is the matrix phase. So all the changes, whether it is contraction or expansion, are occurring in gamma 1 phase. This is the mechanism of action of dimensional change. There are certain factors which favor contraction and certain which favor expansion. So if we use lower mercury alloy ratio, less mercury will be available to coat the alloy particles and formation of gamma 1 phase will be less. So lower mercury alloy ratio will favor contraction. They will lead to contraction. When we are using higher condensation pressure, it will take out the excess mercury from the product or from the mix, and less mercury will be available for the further reaction. So further growth of gamma 1 phase will be reduced and this will lead to contraction. Longer trituration times also lead to contraction, and if we are using smaller alloy particles, that will also lead to contraction, as whatever the crystals are formed for the gamma 1 phase, those will be smaller. So contraction will occur. So these are the 4 factors which will lead to contractions. Main is lower mercury alloy ratio. And factors favoring expansion. So all opposite to these 4 factors are the one which favor expansion. If we are using larger alloy particles, it will lead to expansion. If we are using higher mercury alloy ratio, then even that will lead to expansion. If insufficient trituration is done, less condensation is done, then in that case, also expansion can be seen. Delayed expansion due to contamination of the zinc containing amalgam with moisture is one more example of expansion. This occurs after 24 hours. It is not filled immediately after the respiration is placed. It is known as delayed expansion. This occurs because of presence of zinc. It reacts with the moisture during mixing or during condensation into the oral cavity. If a proper isolation is not done when you're filling the cavity with amalgam, then in that case, delayed expansion can be seen. These were the factors which contribute to expansion or to contraction. Now let's see effect of moisture contamination. When a zinc containing low copper or high copper amalgam is contaminated by moisture during trituration or condensation, a large expansion occurs that starts 3 to 5 days after placement and may continue for months, reaching values greater than 400 microns per centimeter. We have seen the expected value, the accepted value of dimensional change is not more than 20 microns per centimeter. Here, if a proper care is not taken while restoring a tooth with dental amalgam or while triturating the alloy powder with mercury, if moisture gets incorporated, so it will lead to expansion, which is very large as compared to the routine expansion. This will be felt by the patient. The pulpal pressure because of this expansion will be felt up to 3 to 5 days of placement of amalgam restoration. This is called as delayed expansion or secondary expansion. At times, 2 marker is asked on this topic. So it is delayed or secondary expansion. This is seen because there is production of hydrogen by electrolytic action involving zinc and water. So this water, it doesn't react with mercury or any component from the alloy particle. it will get incorporated into the bulk of the restoration, or it will be present at the interface of the cavity wall and the restoration, and will create pressure on the pulp. That's why pain will be felt post insertion of this restoration. That's why it is very, very essential when you're restoring a cavity with amalgam. Proper isolation is important. There should not be any saliva or any seepage present in the cavity. Whenever you are restoring it, you should take proper precaution when you're mixing, triturating the dental alloys. There should not be any contamination with the moisture. So this hydrogen that is formed, it accumulates within the filling, increasing the internal pressure high enough to cause amalgam to creep. So other than pain, the next thing that can happen because of moisture contamination is creep. So we are going to study this later in the next slide about creep. It is basically a dimensional change which leads to fracture of the restoration over the period of time. So due to moisture contamination, failure of the restoration may occur. So it is very important to take precautions to avoid any moisture contamination. It happens with any low copper alloy or high copper alloy. Both the forms can undergo this delayed expansion because of moisture contamination. Moving on, let's see the strength. The next property of dental amalgam is strength. Basically, dental amalgam restorations are brittle. They lack the adequate strength to resist masticatory forces. So it is weaker in tension than in compression. So if at all your cavity is placed at a cuspal height, there is more than compressive pressure, there is tensional stresses which are occurring on the, which are being placed on the restoration, then there are chances that amalgam restoration might fracture. So whenever you are preparing a cavity on the tooth structure for dental amalgam restoration, make sure that tensile stresses will be created to the least possible amount. So basically these are the brittle restorations. Most of the common failures are seen at the margins of the amalgam, where there will be some more tension forces than the compressive forces. Various factors will affect the strength of any dental restoration, of any dental amalgam restoration. So let's see one by one all the factors. Effect of trituration on strength of amalgam. Both under trituration or over trituration will decrease the strength of conventional and high copper alloys. So proper trituration is very, very important whether you are using conventional alloy or high copper alloy. Then effect of mercury content. Presence of unconsumed alloy particle increase the strength. We have seen this. If a good amount of unconsumed alloy particle is present, it aids in contributing the strength of the final restoration. More the amount of mercury, more is the formation of gamma 2 phase, and weaker will be the amalgam. So proper amount of mercury should be present. It should not be less, so that the matrix gamma 1 phase is not sufficiently formed, and it should not be more that the gamma 2 phase will be formed and render the restoration, the final product, weak. So it should be sufficient. The amount of mercury is very crucial. It should be sufficient, not too much, not too less. Insufficient mercury between particles yields a dry granular mix, which results in a rough, pitted surface that promotes corrosion and further reduces the strength. Okay, if mercury is present in excess, there will be production of formation of gamma 2 phase in more amount. That will make the restoration weaker. If mercury is more, then the final product, the final mix will be very dry and it will have a rough, pitted surface. Now on this rough surface, there will be accumulation of plaque, there will be formation of secondary caries, there will be some corrosion happening over there, and it will further reduce the strength of the restoration. That's why using a proper amount of mercury is very, very important. Then next is effect of condensation. Higher condensation pressures are required to minimize porosity and express mercury from lead cut amalgam. So whenever you're placing the amalgam into the cavity. You are placing it in increments, condensing it with your instrument. So whatever excess mercury is there, it will come out and it will then bond with the next increment. There will be proper bonding between the two increments and give a proper density to your restoration and avoid formation of porosity. So higher condensation pressure is acts in favor of rendering the strength to lead-cut amalgam. But in case of spherical amalgam, less condensation pressure are desirable and they produce adequate strength. So condensation pressure is different for different types of amalgam alloys that are being used. For conventional and for lead-cut amalgam, high copper lead-cut amalgam or admixed one, condensation pressure should be high enough. For spherical, single composition, high copper amalgam alloys, less condensation pressure is preferred. Then what if porosities occur in the restoration? Of course, porosity will reduce the strength. So the factors which lead to development of porosity should be avoided. Let's see which are the one. Delayed condensation should be avoided. Condense it as soon as the trituration is completed. Under trituration also leads to development of porosity. So avoid that. Insufficient condensation pressure will also lead to formation of porosity. So make sure that you avoid all these three factors and you get a proper dense restoration. If porosities occur within the restoration, there will be whatever stress will be applied to the dental amalgam restoration will be unevenly distributed over the restoration and it will lead to fracture of restoration over the period of time. Effect of amalgam hardening rate. Well, amalgam doesn't harden or set immediately after placement into the oral cavity. It takes some time. Okay, there is some, it doesn't attain its final strength in the first 5 minutes or 10 minutes once the restoration is done, or not even at 1 hour. So patient will be off. Patient will be sent from the clinic once the restoration is done. So you have to make sure that patient is warned not to subject the restoration to high biting stresses for at least 8 hours after the placement of restoration. By 8 hours, typical amalgam restoration will have reached at least 70% of its strength. So it will be able to bear the high masticatory forces. So it is very important once the restoration is done, patient should be warned not to subject the restoration to high biting stresses for at least 8 hours. ADS specification number 1 requires a minimal compressive strength of 80 megapascal at 1 hour. Among all the alloys, 1 hour compressive strength of high copper single composition amalgam is very high, and if you are using this, it will reduce the chances of fracture immediately after the placement of restoration is done and accidentally that restoration has been subjected to high biting forces. So if you have used high copper single composition amalgam, there are very less chances that it will fracture. But if you are using conventional alloys, then yes, a lot of chances are there that it will fracture immediately after 1 hour if subjected to high biting stresses. Third property of dental amalgam is grip. This is very important. You at times get a 2 marker or 5 marker on this topic. Okay, so grip occurs when a solid material slowly deforms plastically under the influence of stress. So basically, grip occurs on solid material under stresses. When any solid material is subjected to certain amount of stress and there is some deformation occurring in that will be called as grip. So the definition for grip is the time-dependent strain or deformation that is produced by stress. So this is time-dependent. It doesn't happen immediately or it doesn't happen according to the strain that is applied. Okay, it is time-dependent entity. Creep process cause an amalgam restoration to extend out of the restoration site, thereby increasing its susceptibility to marginal breakdown. What happens when creep is occurring? This creep process, makes this amalgam restoration extend out of the cavity. So there will be gap created between the restoration and the cavity wall, and marginal gap will be seen. If the marginal gap occurs, there are chances that whatever stresses are being applied to the restoration will be applied at higher concentration at the margins of the restoration, and then these margins are weak. They can't withstand these high masticatory forces, and these margins break. This is called as marginal breakdown. This happens because of creep. Because of low tensile strength and the onset of corrosion, the protruded segment of amalgam fractures and leaves a ditch around the margin. So basically, the tensile strength is very less for the amalgam restoration at this margin, where because of creep, it has been exposed, it has been extending from the restorative, from the cavity walls. Corrosion will start, and this will reduce the strength of margins of the restoration, and fracture will occur. You can see a tooth with two amalgam restoration. On the left, you can see the margins are really rough. You can see the cavity walls are exposed. So creep, because of creep, there is deformation of this dental amalgam restoration. The margins were extending from the cavity walls, and because of that, there was marginal breakdown. A ditch was seen between a gap was seen between the cavity walls and the restoration. This is a low copper alloy, which is used for left side restoration. On the right side, you can see high copper admix alloy was used. Okay, so the margins are pretty intact. The contact with the cavity walls is intact. There is no gap between the two. So low copper alloys are the one which are subjected to marginal breakdown or to the creep the most. So higher creep rates are seen with low copper amalgam with higher gamma 1 volume fraction. Gamma 1 fraction is more with low copper alloys, right? The matrix is really more with low copper alloys. Very low creep is seen with single composition high copper amalgam. This is because we have seen that in the prior diagrams that eta phase is present in more amount in single composition high copper amalgam, and this eta phase has this rod-like structure which interlocks the particles of gamma 1 phase. As these particles of gamma 1 phase are interlocked by the eta phase rod, they will resist the deformation under any stress. So that's the reason why single composition high copper amalgam will have very low creep. There is no eta phase in low copper amalgam. That's why these particles, these molecules of gamma 1 phase, they are not interlocked with each other, and they will deform under stress over the period of time. The manipulative factors that maximize stress also minimize creep for any given type of amalgam. So if we are using proper alloy mercury ratio, if we're using high copper alloys, if we're using proper condensation pressure, proper trituration is done, then there will be more strength to the restoration and less creep. This is also a very important topic, tarnish and corrosion resistance. So what is basically tarnish? It is surface discoloration or slight loss of luster on the alloy caused by formation of thin films of sulfide, as in case of dental amalgam. It can be oxides or chlorides also in case of other metals. But there is any significant chemical reaction involving the underlying alloy. So basically, it is not a result of any chemical reaction of the alloy. It is just surface discoloration or slight loss of luster due to formation of thin sulfide films, right? But it is considered as an early indication of potential corrosion. If tarnish has not been taken care of, if the final restoration doesn't have any, is not been finished properly, then tarnish will occur, surface discoloration will start, and this will lead to corrosion. So basically, it is a precursor of corrosion. Tarnish is precursor of corrosion. What is corrosion? It is actual deterioration of an alloy. due to chemical or electrochemical reaction with its environment, often leading to loss of material or weakening of the dental restoration. So, corrosion is deterioration of alloy due to chemical or electrochemical reaction in the presence of its environment. Okay, and this will lead to loss of material or restoration will be weakened. Most common corrosion products found with the conventional amalgam alloys are oxides and fluorides of tin. Okay, whatever chemical reactions occur during corrosive process, it will lead to formation of oxides and chlorides of tin. So these are found at the tooth amalgam interface and within the bulk of amalgam restoration. Gamma 2 phase is implicated in both marginal failure and active corrosion in conventional alloys. Gamma 2 phase is the one which will weaken the tooth structure to a greater extent because of its participation is in marginal failure and in corrosive process also. Eta phase is less susceptible to corrosion than gamma 2 phase of conventional amalgams. That's why as eta phase is present in high copper amalgams, especially the spherical one, single composition spherical, this alloy is not that much susceptible to corrosion. Also, smooth homogeneous surface on a restoration is very essential in order to minimize the tarnish and corrosion. If the surface is well polished, smooth, the tarnish won't occur, and if tarnish is not happening, it won't lead to corrosion for at least few years of restoration. So the longevity of the restoration can be increased. There are different types of corrosion that can occur. First one is galvanic corrosion. It occurs when dissimilar metals come in contact with an electrolyte environment like oral cavity, where saliva will act as an electrolyte medium. When you have any gold restoration into the opposite tooth and now the antagonist tooth is being treated with or restored with silver amalgam, then corrosion will occur with the silver amalgam restoration. Then there is uniform corrosion, a general corrosion attack that is more or less distributed over the entire exposed surface of the metal. It is not particularly present at the margins of the restoration or any pit that is present or any irregular surface that is present on the restoration. It occurs overall the complete surface of the restoration. Then pitting corrosion is seen in the localized area where small pits or cavities form in the surface. So it is basically maybe because of presence of some porosity. Then crevice corrosion occurs in crevices or small spaces of the material surface where stagnant solutions accumulate. So this is basically seen where marginal breakdown is present. There is gap between the margins of the restoration and the cavity walls. Crevice corrosion will start. The next is stress corrosion. When stress is present in a metal object and it comes in contact with a corrosive environment, stress increases the likelihood of corrosion. So basically it is dependent on the stress. A gold restoration is placed in contact with an amalgam. Corrosion of the amalgam can be expected as a result of large differences in electromotive force of the two materials. So these are the basically dissimilar metals. That's why corrosion will occur. But it also happens if high copper amalgam restoration is placed with an existing restoration of conventional amalgam. In that case also corrosion will occur. This is basically because of differences in the electromotive forces. These are very commonly occurring cases when dental amalgam restoration was being used. Nowadays it is not used, but still it was there present previously. So whenever a gold restoration is placed in the oral cavity, amalgam restoration was not preferred. Or if the prior restoration of amalgam is done with the conventional alloy, it is preferred to do the next one with the conventional amalgam only and not the high copper amalgam. Because then if we place high copper amalgam in the presence of conventional amalgam restoration, it will lead to corrosion of the conventional amalgam restoration. That was all about tarnish and corrosion, which is also a very important topic. 2 marker or 5 marker is asked on that. 2 marker or any short essay is asked on that topic. The last one is mercury hygiene in dental offices. So basically, we know mercury has concerns over the safety, though there is no data regarding any harmful effect of mercury on the lab personnel or on the clinician or in the patients. Still, taking proper precaution during handling the mercury is very, very essential. Is very, very essential. So the potential hazards of mercury can be greatly reduced by attention to a few precautionary measures. If you take all these precautionary measures, there won't be any mercury poisoning or side effects of the mercury seen on the lab personnel or on the clinicians. Let's see what all are the measures which are supposed to be followed. The first one is correct disposal of potentially hazardous waste material, including dental amalgam and mercury. So correct disposal is very important. Whatever scrapings are there, whatever excess mercury is left, you're supposed to dispose it of very properly. Then the operatory should be well ventilated so that if amalgam vapors are formed, those can be ventilated properly without affecting the clinician. All excess mercury, including the waste, disposable capsules, and amalgam removed during condensation, should be collected and stored in a well-sealed container and then disposed of properly. It should not be placed into the disposal bag loose. It should be kept in a airtight container, well-sealed container. Then amalgam scrap and the materials contaminated with the mercury or amalgam should not be heat treated. All the instruments which are having some amalgam scraps on it should be cleaned first and then sterilized. Sterilization with mercury present on it is not advisable. If mercury is spilled, clean it up as soon as possible. If mercury is spilled over the carpet, it is very tough to remove it from the carpet. You cannot use vacuums for that because it will then increase the hazard of mercury. It will get incorporated into the air. So you have to make sure that you use some mercury powders which are available in the market, which will coat this liquid mercury and will be easy to collect for disposal. So if mercury is spilled, clean it up as soon as possible. Avoid the use of vacuum. Use some mercury powders which are available. If mercury comes in contact with the skin, it should be washed with soap and water immediately. Water spray and suction should be used when amalgam restoration is ground. Say, for example, a patient comes with old amalgam restoration and then you have to take out all the faulty restoration. Then make sure that you are using a proper suction and water spray during taking that restoration out. Eye protection, a disposable mask and gloves are mandatory. Whenever you are treating any patient who's having old dental restoration and you're working on it or you're triturating a dental amalgam, make sure that the clinician is wearing eye protection, disposable mask and gloves. It is very important. Then periodic monitoring of actual exposure levels should be carried out. If a lab personnel is using amalgam over the period of time, for a very longer period of time, periodic monitoring of actual exposure level should be done. He can use the badges which are available for the X-ray technicians in the radiology unit. So such kind of badges are also available, which will give you the actual exposure level, or you can take the blood samples and get it checked for the mercury levels. Periodic monitoring of actual exposure level should be carried out. So that's it for amalgam, dental amalgam. We completed today. This is one of the very important topic. If you have any query, you can just ask it in cleared out section. I will clear it there itself. Thank you.